Welcome back to This Week. I'm pleased to be joined by Kelly Insana. She is the Vice President of Marketing and Media with the Tennessee Hospital Association. Nice to see you again.
Great to be back, Bob.
You were back here just a couple of months ago, 3 months ago roughly. And you're back because the situation with hospitals nationwide and in Tennessee has actually gotten worse. Sadly, what the new report is out and says the crisis in rural health care in Tennessee, the closures here, has gotten worse since just 5 months ago. New report confirms a third of all rural hospitals in the country, about 700, face the risk of shutting down, and roughly 40% of all rural hospitals are operating at a loss. This is not a sustainable working model.
No, and that's the word, sustainable. And that's what these reports are listing right there is the metrics that they look at, cash on hand, revenue, expenses, is not sustainable. And that's what puts them at an at-risk category. And it's something that obviously the Tennessee Hospital Association has been aware of for a while, something we've been talking about. Not only does it impact the hospitals themselves, but the communities, because eventually something has to change. Sometimes its services are no longer offered,
right,
which we've seen that in Tennessee in the past couple of years. Some hospitals no longer offer OB care. And then sometimes it does lead to closures, which, as you know, has already been a problem in Tennessee.
Talk a little bit about the classification, at risk, at imminent risk. It still doesn't mean they're immediately going to shut down. What it says is they're not covering their bills, they're not able to effectively provide services sometimes, and they're in danger of saying we may not be able to continue this.
That's correct. It's something to watch and say it's not sustainable. Things need to change. And that's, what we're doing at the Tennessee Hospital Association is trying to advocate for some of that. We have some federal funding cuts coming that are going to impact all hospitals in Tennessee, but rural hospitals even more because they have narrow margins. They have, very little wiggle room when it comes to that. And they just are more vulnerable in general because of the negotiating power that they have. They're smaller. They have higher Medicaid, Medicare, which can pay less.
12 or 3-4 months ago, when you were here last time, there was 12 hospitals at risk, 8 hospitals at imminent risk. It's now 19 at risk, 12 at imminent risk of closing. Why has it continued to grow in Tennessee?
I don't know the specific methodology that they use there, but I think it's just an ongoing issue. And it was our biggest issue several years ago. I mean, in
Tennessee was #1 for closures not too long ago. I think we're 6th now, so it's gotten a little better, but we're still pretty high.
We're highest when you look at total per capita. Texas has more, but they have vastly more hospitals. But it's something that we've been looking at. I mean, just a few years ago, 60% to 50% of Tennessee hospitals operated at a loss. And so we spent the past couple years trying to build up programs and improve that. And we've made some headway, but these federal cuts that are coming will impact that.
Some of the reasons you're going to talk about a crisis, the loss of federal aid, as you talked about, the expiration of the pandemic era, financial relief, the Obamacare credits, also responsible for thousands of Tennesseans now being without health insurance. That puts even a bigger burden on these hospitals.
Right. I mean, hospitals are the entity within the healthcare system that treats anyone. You come in any time of day without ability to pay, and a hospital is going to treat your emergency. And so uninsured will impact that. Right. And we just saw, we're seeing some of that come out right now from stories from hospital leadership that we're seeing more of that. But we know 71,000 fewer Tennesseans signed up for coverage through the marketplace. So we're just now trying to see, is that really impacting care? And we're hearing that, yes, they're seeing more uninsured, but the other side is they're seeing more people who are what we call underinsured.
Yeah. You talked about policy changes that are coming. Recent federal budget and Medicaid eligibility shifts, increasing the uncompensated care costs for the safety net hospitals. So that already increases what they're not getting paid.
Yeah, I mean, it really does revolve around payment. And we're sitting here talking numbers, like we do because it's a business in its own way. In order to stay open, you have to make enough money. But what really is these patients in these communities. And I have several of them that I could list off, but one that comes to mind is a high school football coach in Hardin and Savannah, Tennessee, rural Tennessee. Everybody in the community knew him. He had chest pains and barely made it to the hospital in time. And they were able to save him, and they weren't going to let coach go. and they were able to save him, and he was treated in his community. And those are the types of things we have to remember when we talk numbers.
And there are growing hospital deserts in Tennessee, especially for postpartum prenatal care for expectant mothers, getting to hospital facilities, the distance is increasing.
So it is important that we keep those community presence available. And then, yeah, maternity deserts is a big deal. The March of Dimes just had another report covering that, and Tennessee was not on the good list.
The federal money that gets lost, the state has already said that they can't dollar for dollar meet that gap. But there has been some wins in Tennessee. The legislature has increased some funding. How has the Tennessee legislature helped ease this a little bit?
Yeah, so that program I mentioned before,
Yep.
it's called the Hospital Investment Program. It helps cover that shortfall that hospitals experience from uncompensated care or underpayment. And so the legislature was very helpful in helping us.
They see the problem.
Yeah, and helping us secure the funds. And then we had our congressional delegation as well. It took federal approval, advocating on our behalf. So, I mean, we have had good support. It's just now, when we put the program in place, we thought, oh, this is really needed. This is a lifeline for our hospitals. And then now we're kind of fighting to protect it. You
talked a little about when we were talking on the phone the other day about creativity and how some communities are looking at different aspects of healthcare to try to provide something to fill these gaps. Fairview is an example. They're getting 2 emergency facilities that they didn't have before, so they can at least treat trauma and then have to, transport to a major hospital, or other communities kind of looking at the same situation, getting something for treatment rather than having nothing.
That's exactly it. You want to have what I would call a healthcare presence. So you just don't have nowhere to go. And we've seen that. I mean, when the Jellicoe Hospital closed, I mean, that was a big impact for that community. And they're still, I think, trying to figure it out. But you want to have a healthcare presence. Of course, you want to have emergency care as quick as you can, which helps, with having those in communities that need them where they don't have that healthcare presence. But also trying to think of innovation through telehealth, remote monitoring, that sort of thing, to make sure people get the health care.
For the communities dealing with this crisis without health care, what can the people living there do? I mean, it takes more than a voice. It takes money, and they can approach the legislature, approach their congressional representatives all they want, but if Washington or Nashville doesn't approve the funding, that's really the bottom line, isn't it? Yeah.
Well, I mean, but that's how advocacy works, right? So, I mean, hearing from constituents in your community who say, my hospital is important to me, that is important, because they're going to be making decisions based on what their constituents want. But it's a long battle, and funding across the board is scarce for a lot of things. So.
Are you positive or negative? Are we at the worst part it's going to be? Could things get worse? Are we improving in any way?
Oh wow, that's really hard for me to answer. I mean, COVID was pretty rough,
yes,
so
it was.
We're just kind of out of COVID, and then we had a workforce crisis, which we're still kind of working on. I'm going to be optimistic. I'm going to say, we're working as an industry. We're working with our stakeholders and our elected representatives because, in general, people want their hospitals there. I mean, I think that sentiment's there.
Kelly Insana with the Tennessee Hospital Association. Appreciate your time and your insight.
Thank you very much. Thanks, Bob.
Stay with us. This week continues in a moment.